আমাদের এখনকার লেকচারটি হলো রোটাভাইরাস and viral gastroenteritis. Rotavirus is the most common cause of viral diarrhea among the children. In Bangladesh, 6,000 to 14,000 children dies every day, and it is responsible for 35% of all diarrhea in children in Bangladesh. So this is very important. What are the other viruses that cause diarrhea? Rotavirus is the most important. About then adenovirus, norovirus, and astrovirus. So these four viruses are responsible for viral diarrhea. Rotavirus is a double-stranded, non-enveloped RNA virus. This is the only RNA virus that is double-stranded, and it is non-enveloped, so it can cause diarrhea. It can remain in the environment. It is very stable in the environment, and it has got a peculiar structure. It has got 11 segments. You see, this is the structure. There are segments. We can count 11 segments. So just you will have to remember. You will have to remember double-stranded, 11 segmented virus, RNA virus. How rotavirus causes diarrhea? It infects the epithelial cells of the small intestine and multiplies in the tip of the villi. Resulting in death and disformation. These villi are responsible for absorption of fluid, and as there is a death and disformation of villi, there is a reactive hyperplasia of the crypt cell. So there is decreased absorption of fluids and nutrients and increased secretion of fluids. These two factors are responsible for diarrhea caused by rotavirus. There is another factor, but you need only these two. If you remember these two, there is enough. The date of the villi and reactive hyperplasia of the crypt. And this results in non-bloody watery diarrhea associated with fever in children. Nausea, vomiting is also present. And once a child is suffered from this diarrhea, actually immunity develops, and the children who are fed by the mother's milk, they are also the infants. They remain protected up to 6 months of age. How can you diagnose laboratory? Very easy. Detection of viral antigen or particle from the diarrheal stool and nucleic acid based technique. So a specimen will be stool or rectal swab, and detection of viral antigen or nucleic acid based technique, that is electrophoresis or PCR. It's very simple. Treatment is also very simple. ORS, or if more dehydrated than intravenous therapy, vaccines are available, live attenuated vaccine. So this is all about this rotavirus. So what is the most common cause of viral diarrhea and what are the other causes? In the first slide, I have shown rotavirus is the most common cause. Other causes are norovirus, adenovirus, astrovirus. Pathogenesis and lab diagnosis we discussed. Peculiarity of rotavirus structure: it is a double-stranded RNA virus, and it has got 11 segments. As its structure is like a wheel, so it is known as rotavirus. Why it is called rotavirus? Because its structure is like a wheel. So thank you very much.